Well, good afternoon. This is Harley Ferguson. Good afternoon and welcome to the IBHRE live Facebook chat for a sneak preview into the Cardiac Device Education and Self-Assessment course. Hello, my name is Harley Ferguson. I'm the chair of the IBHRE Ambassador Committee and Curriculum Specialist for the course. Thank you for joining us. For the next 30 minutes or so, I'll be your guide for an inside look at the course, its design, its content, its layout, and its functionality. I will introduce you to our menu, the subject matter experts, and a close look inside some of the individual modules. Now, although this course is based upon the CCDS exam blueprint, it is not all-inclusive of all the knowledge areas and the skills assessed for certification, and we will not be discussing the formal CCDS exam or specific exam questions, of course. This course can certainly, however, be a benefit to those of you preparing for the exam or expanding your knowledge base or enhancing your skills. Now, if you're a lab manager or a department educator, this can also be a valuable tool for new hire orientation, annual review, or as an addition to your developmental curricula. Now, I'd like for you to know that in the event that if something should happen, what I'd like to share with you is just the assurance that if you need information about this, about the course or more about IBHRE, you can go to ibhre.org at /CDESA, or you can contact the International Board of Heart Rhythm Examiners by email at info@ibhre.org. I'll show you this again before we end today, just as a reminder. And in case you're wondering, we are using the internet and some cell phone connections. Now, there may be unexpected disruptions or noise on the channel, and some of that can be minimized if you mute your cell phone, and we appreciate that. However, in case you lose connection or you're unable to stay for the entire chat, rest assured this session is being recorded and it'll remain available to you or your colleagues through the Facebook portal. You can also register for this course, as I just described for you, by the ibhre.org/CDESE link. In the meantime, let me show you now where we're headed. Among the first things that we're going to do is examine the tools for today's chat. And if you take a look at the bottom of your screen, you should see a comment window. This chat window, which is visible to everyone throughout the session, is your personal access point for sharing your comments and your questions. Now, secondly, I'd like to know, can you hear me okay? Do me a favor and drop a Y for yes or an N for no. Let me know that you're out there and let me know that you can hear me okay. The IBHRE is very interested in hearing from you, especially your questions. In a few words, what we'd love to hear from you today, and thanks, Kevin. Great. Adam, Caroline. Great to hear you guys, or see you guys. Good. Thank you for doing that. Also, what I'd like to hear from you, if that's possible, while we're getting ready for this, is I'd love to hear from you why you're here today. For example, some of you may be here preparing for the exam, maybe changing or advancing your career, or perhaps simply stated, you might say, I just want to enhance my skills to be better at my job. I heard a saying recently that says, be good or be good at it. So for whatever reason, we're glad you're here. Thanks for coming. Now let's get started with an overview of the course design. As you can see from the screen, and I'll try to move my mouse purposely so that you can visualize that. But if you'll notice when we look at the screen, I'm going to draw your attention to the 3 hash marks at the top left corner of the screen. This is your access point for navigation, and this will allow you then to open and to see everything that's in the course, or what the entire course content and structure looks like. Now, there is a section on course overview, and that basically describes who this is for, what this course really is, and what value you may be able to get out of it. And I encourage you to take a few minutes to read that on your own when you have the chance. The other section that I want to show you is a little bit about the course contributors. The course contributors are those people we referred to as subject matter experts. And without a doubt, they are. And these folks represent a large group of people from a variety of backgrounds and roles and responsibilities. So here there are physicians, nurses, engineers, and they also span the international space. So we have people from on this group from Asia and from Australia, and of course the US. As you can tell by looking at this screen, you can take a quick look at the bio sketch of any one of these individuals. And yes, if you look over to the right, you'll see my name is there. And if you click on my bio sketch, you'll certainly be able to find out a little bit more about who I am, what I do, and where I came from. And that's important for all of us. As you'll also note, that there's a gentleman whose name appears above mine, and for good reason. And that's a picture of the late Tom Kenny, who perhaps known to many of you and many of my colleagues in this business as one of the leading educators who made major contributions to the design of this course. And of course, he touched an awful lot of lives as an educator. And he is now resting in peace. But that is Tom Kenny, and here is Tom Kenny's bio sketch. So let me take you a little bit further into the course. We'll go back to the menu. And the introduction is a discussion a little bit about how the course operates and how you can manipulate or navigate throughout the course. As we go further down into the sections here, these individual sections that you see are what we call subject areas. And within these subject areas, and I'll give you a sample, when you click on here, you can see this allows you to get access to these categorized specific modules. For example, battery and pulse generator technology, leads and electrode materials, device programming and timing cycles, Brady algorithms. These are laid out this way so that you can select any one of those that you want to select at whatever point in this course you want to do that. So if you wanted to start with something very basic, very fundamental, you might choose something like radiology or electrocardiography, particularly if pattern recognition and electrograms are a definite area of interest for you and or a challenge. Let me give you a little look about what, excuse me, what some of this might look like inside.
Welcome to the module.
As we open the module,
Click next to continue.
you'll see, and this is by Sachin Nair, there will be a narration along this lower band that you see at the bottom. If you want to advance quickly past the narration, all you have to do is click out to the right side of that bar, and it will complete that and show you everything that's on the screen. But let me give you a look through this course. Here's something that's consistent throughout all the modules. What we want to present at the very beginning of every course or every module is a set of contents. Within the contents, this allows you to recognize what that content will look like, what pieces of information, what essentials are here. And that means if you're looking for a specific subject area, you may be able to scan this quickly and find what you're after and know that you're in the right module. As we go from here, the next thing that you're going to see in every module is you're going to see a clear set of objectives. Objectives are often referred to as the how do I get there kind of roadmap to any particular mission or any goal. And in this particular case, we have intended to be very specific about what these objectives are. In other words, in the objectives for radiology, as an example, we'll define normal radiographic anatomy of the thorax. Many an expert have told me that once you learn what normal looks like, then the abnormal will jump right out at you. So that's usually really where we're going to start. Let me show you a little bit more. There's some other features that are visible in this particular module I want to share with you.
Let's begin with a normal chest x-ray.
You can imagine in this case, we're going to be looking at x-rays. So the nice thing about having an x-ray, while this particular slide is giving you an introduction as to the standard locations or the standard x-ray formats, then when you see an image appear within the module, you'll see a small little marquee here for increasing the size of that image so that you can bring that up and get a much closer look at that. That sometimes may be helpful while you're listening to the narration or the description of the slide. But you'll find this common throughout the entire course. Also, as we go through, there will be a multiple of bits of information for you. By the way, we have some great electrograms that are complements of Dr. Charles Love that come out of his personal experience, and he made many contributions throughout this particular module. As we go through, what you'll also expect to see is what we think is fundamental information about the structures that we see are important to us in our particular science. And I'm just giving you a sample of what that might look like. Now, in this particular case, in this slide called the normal LV lead position, you'll also notice at the bottom of the page is a circle with a little notebook. And what that means is that this is an access point to the reference that was used for this particular set, this topic set that you see here. And this we intend for you to be helpful. So if you're looking for some of the scientific data that we have used to build this course, you'll be able to find that in these resources. I hope that makes sense to you. Among the other things that are consistent with this course, for example, is not just the references, but it is the content of the material itself. For example, in this module called Pacemaker Clinical Trials and Indications, there is a section here where you'll be able to download the PDF copies of the practice guidelines that are so essential in coaching us in our profession so that we are conducting ourselves and following guidelines that have been well established by the experts in our field. For example, the PDF will be here. You can highlight that, click on a link, and within seconds you should have that PDF. This is downloadable for you, so you can print that and read that at your own speed. So I'll take you back here, and there's a couple of other things that I'd like to show you. So as an example, in pointing out the question things for you, let's see, I just want to mention that we do have someone signed on from Perth, Australia. Emma, great to see you here. Thank you very much for being here. And then we've got somebody that's a 13-year industry veteran preparing for the CCDS recertification. We'll be thinking about you, Kevin, and we hope that this will be of some value to you. And there are some great people being here. These are names, some of them I recognize. It's good to see you folks out there. Okay, so a little bit more about this. There are some specific areas that I want to take you to, and that is the glossary of terms. So you take a look down here. Glossary of terms is really what we refer to as the lingo in the language of our science. And sometimes it's really hard when you see a lot of acronyms and a lot of terminology, and it's really hard to figure out what they mean, particularly when it comes to devices and programming modes and codes. So here is just for an easy access at any time that you might be going through a module where an acronym pops up and it's not well explained, although we took great care in providing you with acronyms and then the full statement of what that means. So now you'll be able to access this, just pick any letter and you get what you're looking for. And that's the glossary of terms. There is a particular area here called device and patient management. So for those of you who are really just working to improve your educational skills or your follow-up skills, or you're working in device clinics, often this is a great subject area to look at that will give you guidance as to what most practitioners will do, and certainly you get the inside look of what these subject matter experts have put together for us. I just want to give you one one quick look at device and feature selection. Often, as we know, there are individuals.
Welcome to device and feature selection.
And this is by Jane Price, a clinical engineer and a writer in her own regard. She put some great information together here for us. And these particular sets of information that really take you through the single chamber, dual chamber, biventricular pacing, and high voltage and anti-tachypacing therapy. This is the kind of information that is important when it comes to determining the right device for the right person or to meet the physiologic needs of that particular patient. So I think that you'll have
guidelines for device selection.
You'll enjoy going through this particular module, and it's almost like talking to Jane directly. A magnificent mind with a great method for which she brings out this information. Once again, here's another sample of the expert consensus statement, which you can download directly from this particular slide. So we're real grateful for Jane for her contributions and her design here in this particular module. As we move through this, there's an area that I think is really going to be important to a lot of you, and that's going to be this case studies area. So when it comes to case studies, it's hard sometimes to know exactly how we learn, but there's a large number of practitioners when we get into this field that learn from looking at the real life experiences of other people, and then also learning about these things that are essential to a practitioner's particular perspective. In this particular case, this is a section that was put together for us by Lori Newmark.
Welcome.
And Lori is a great contributor. She's also an IBHRE ambassador, and she has a depth of information in running device clinics. So you can expect that Lori Newmark is somebody who really knows what she's talking to, and she'll enjoy this a great deal. So before I go into this, I just want to answer a quick question. There's a message here that says, is there a PowerPoint to follow or a website to click on things? How do I get to that homepage? Well, as a matter of fact, I'm just going to answer that question for you real quick and show you here that this is the place to go for that information. So when you want follow-up information about what resources are available, either about the course or about preparing for an exam, this is a good place to do that. So just taking a minute to get that question answered for you. And we're back to case studies. So when I mentioned about case studies, this is something that you might enjoy working with.
Here are some tips,
and that's being able to see the case studies as a patient is presented, for example, into a clinic or into an emergency room. And in this particular case, you'll be able to read, for example, your patient presents to your clinic with the previous ECG, and you determine that this is, so now I'll come over to the ECG, click on that, make that larger. Study that for just a second. Give you a look at that, by the way. And when you look at this is your opportunity now to make a judgment about what you see. If you're having difficulty with EKGs, remember that we have a module that's specific on EKGs, in the basics of reading 12-lead EKGs to the advanced reading of pacemaker EKGs, 2 different modules. So if you get challenged by this or confused by this, then you can go out of that and come immediately into electrocardiography or the basic concepts in ECGs and pacemakers. And when it comes to electrocardiography, the challenge in getting through this, here's a program done by Dr. Alexander Green from Loyola University. And as you're getting through this, you'll find that it'll make sense. And it's common that you'll be wanting to learn a mnemonic or a method by which you learn every EKG, or you look at every EKG in the same way. And that's what's recommended here. So a systematic approach that keeps you organized and guards against focusing on obvious abnormalities and overlooking subtle findings. So it really breaks it down in helping you develop a descriptive analysis and a clinical impression. And this can really enhance your appreciation for EKGs. After all, there is not a single device implant decision or an electrophysiology study or ablation that is done without the value of a 12-lead EKG. So this is natural and normal for all of us to have this as the backbone of our skill sets. So as we come down to this, I'm looking now at one of the last pieces here, and that is the cardiac device post-assessment. I did, however, neglect to show you something, and I just want to pop back here very quickly to surgical techniques. There is something that we built into each one of these modules. And in these modules, we have an opportunity for you
Upon completion,
to gather knowledge checks. The knowledge checks are a little bit more unique than what you might have experienced in the past. So I'm taking you forward through this one just so you are able to see what that looks like as we pass the areas of patient prep, preoperative measures, and prepping the patient. This probably looks familiar to a lot of you. I know who have spent some time in the lab and have participated in device management and device implants. Here is a little interesting page for you. You realize as we're going through this and trying to scan, it stops us and says incomplete. Please complete the activity before moving on to the next slide. So what that means is when you see these bars like this, it means that you should open each one of these and make sure that you have an idea of what's happening here.
Pain control and sedation.
And sedation is a very important part of what we do and what's necessary for each and every individual patient.
Patient typically asleep, but easily arousable and achieved with a combination of Versed
and then finally, deep sedation.
Deep sedation.
There is a difference, and there are a number of practitioners out there that I'm sure have found that there are some elements of sedation that are within their control and some things that are not. But most important is to be able to recognize appropriate sedation for the patient's sake.
Let's move on to venous access.
So we'll talk about venous access, and as we're going through this, I'm just going to advance through some pages because I want you to see what the knowledge check looks like. Incidentally, I might point out to you that when you think about implants, that you're going to find that there is a variety of practices that are performed by clinicians all around the world. And it's best to find a good mentor or a good practitioner that has a very comfortable and consistent way of doing these things. as you're looking to enforce your knowledge of how to do that. So let's check your knowledge. Here's what the knowledge check looks like. Here's a 54-year-old gentleman receiving a dual chamber pacemaker for high-grade AV block. The implanting physician decides to use the subclavian vein for venous access. So what's the primary complication of this approach? Yeah, you take a look at this and you ask you, and I'm just going to open one and see if there is something that makes sense. So I'll select my answer and I'll submit. Okay, as you might expect, and this has happened to me more than once, it's an incorrect answer, so we'll try again. Now the incorrect answer is still there. Is it a pneumothorax? Well, we'll submit that as a question and find out. That's the correct answer. As a matter of fact, this complication occurs uncommonly and is directly related to operator experience, et cetera, et cetera. And that's verified by the resource that we have here. So the idea, of course, is that we want to provide you for the correct answer, not just beat you up over not getting the answer correct, but rather give you the rationale behind the correct answer. Going back to the main menu here, and we'll continue.
On to lead placement.
So let me answer a question for you. Kelsey Robinson asks, we are able to take the tests multiple times as well? The answer is yes. In this particular course, you can take this course as many times as you need to until after you get down to the cardiac device post-assessment, and then you close the course. But otherwise, you will have repeated access to this. As a matter of fact, when you go from one module to another, if you haven't completed it, you can close your window and then return to the same spot. Matter of fact, it will ask you if you want to pick up where you left off or resume where you left off. So the answer is yes. So you can get at this hopefully as much as you need it throughout your course of study. And that, of course, is the description I was getting to last here in the cardiac device post-assessment. Here's a set of questions that were developed for you by a large group of clinicians who are familiar with testing and examination. Now, these are not meant to duplicate the questions of the exam, but they are designed so that you will make sense of what they are and how they might look in an exam state. Provides you with the answers to each question so that you can identify strengths and weaknesses. Although your post-assessment performance does not guarantee success in certification, it will help you gauge your retention of the course material and guides you through your next steps to acknowledge the assessment and review. So that covers the majority of the course and what it's about. So I have seen that there's a lot of questions here. And let me make sure that we have some answers for some folks. So I'm going to scroll through here briefly and make sure that I can answer a few more for you. Kelsey, Rob, how many questions are on the final? And by that, I think you mean the final of this cardiac device post-assessment.
Welcome to the IBHRE.
And I believe we have 50 questions that are associated here. And I'd have to go back and review that to tell you for sure, but it's going to be a minimum. It's probably between 50 and 100 questions. I hope that's helpful. As a matter of fact, my colleagues that are on here with me, if that is different, please send me a note to that effect. I'd be greatly appreciated. Okay, so you guys have been talking to each other while I've been doing this. And tell me, is there anything that I haven't covered that you'd like to know? And I'll give you just kind of a second to do that. While we're doing that, as you pop up some questions, I'm going to show you a particular piece of information I thought was really well done. Oh, let me point out to you that when we look at pacemaker clinical trials and indications and the ICD and CRT clinical trials and indications, the methodology for which these indications are designed and the methodology by which we learn the indications and practice guidelines, these are the fundamental guidelines for all of that. When you think about why one doctor does it one way and a doctor does it another, but rather there is a consistency and a consensus among the experts, and that is that combination of folks from HRS and ACC and AHA. And it's really good to be able to have all three of these when you're trying to work with a patient and decide whether or not a device is necessary. And it's often based on risk assessment or risk-benefit ratio. And these are worth looking at and examining closely so that you have a good, strong idea. If you are in that decision-making chain when it comes to individuals and their devices. So now that we've come to the end of that, and we've seen some of your questions, and if I haven't answered the question, and John Hunt, for example, asked, how much is it? And the answer was, basic price is $399. However, there is a discount for group rates, and there might be some other considerations that you may want to ask the IBHRE about. And as a reminder, if you have questions about this particular course and about the details of the course, go to IBHRE and take a look at the course, read back through the demo, find out more about what it is for, what the benefits will be, and then email the staff at IBHRE, and I'm sure that they're going to be glad to answer any questions that you might have. But I can tell you this from my perspective, and for the period of time that I've worked with the IBHRE staff here, is that first of all, I recognize that this is a tremendously valuable course. It's comprehensive. We spent a lot of time going through a lot of subject matter, and there were a lot of experts that weighed in on what was essential to the course and how the course should be designed and developed. It's been heavily reviewed by a number of people, both in our profession and by some of the same subject matter experts that are part of the policies and procedural guidelines that you see from HRS and ACC. I'm confident that if this is a path that's consistent for you, if you're looking for something to advance your career or to improve your work as you do it now, or if you're looking for ways to prepare for the exam, then I'm confident that this course will help you do that. So as we come to the close of this, I hope that I've answered your questions. I'm really glad that you were here. I really appreciate the opportunity to be able to talk with you. And I'm just one of the guys that's been like you many times, many places, trying to figure out what happens next. What do I do next? How can I do my work without hurting anybody? How can I be above the standard that are expressed in the expectations that we have when we meet our patients and we meet our employers. So I hope we've been helpful in providing that information with you. And Chris Ballard said, is there a discount code? That's a really good question for you to send, Chris, to info@ibhre.org. And for those of you who have several people that you are coaching, teaching, you might be the hospital educator, you might be a device education coordinator or manager. And I'm sure that you'd be able to speak with the IBHRE about making multiple courses available to enhance your programs. So if I haven't missed anything else, last call, let's see, last call for messages. I see, Adam, while your interest here, 20 possible colleagues. That's great. Okay, and Matt Handy says, I can't seem to watch this on my desktop, so I'm watching on my cell phone. And that is, of course, for you, Matt, is to get to the Facebook page and to the IBHRE. And if that is helpful, for those of you who are watching, would you please send that link to Matt or put that in the message? That would be great if you haven't already achieved that. So I'm scanning as we go through this, and watching on mobile is better. Okay. Thanks, Saja. Kelsey. And John Hunt. Adam Jensen. Is the final exam timed? That's a good question, as it is in a similar format to the actual exam. The answer is no. There is no specific time. You can take your time. Go through that. As a matter of fact, take that exam as many times as you want to until you determine that you're satisfied with your knowledge base and you're comfortable with that. Also part of that final exam on this course is an opportunity for you to see your areas of strength and weaknesses. And that's going to be extremely valuable for you to let you know where you need to pay closer attention or where you need to concentrate your study. So I think we're in good shape. I'm getting the signal that it's time for us to end. Thanks again for everybody for joining us and for being here, and hope that you'll reach out to us through IBHRE. It's been your pleasure. I'm Harley Ferguson, and I'm glad that we had some time to spend together. So good day to everybody.